Hello everyone. If you're watching this video, then you or somebody you love is suffering from an autoimmune condition. So what we're talking about today here is functional neurology and nutrition for autoimmune type of conditions. Now, I just want to introduce myself. My name is Dr. Aubry and I'm a board certified chiropractor. I'm board certified in integrative medicine. I practice in South Burlington, Vermont, and I'm a board eligible chiropractic neurologist as well. My practice focuses mainly on neurometabolic conditions, so I see a lot of autoimmune conditions in my office. I also sit on the executive board of the American Association of Integrative Medicine. Now, what we're going to be talking about here today is autoimmunity. You're going to get a big picture of exactly what an autoimmune condition is. When we see something like autoimmunity, parts of your immune system aren't working properly. There might be some parts that are working higher, or what we call hyper, and some might be working lower, which we call hypo. When you have an autoimmune reaction, the only difference is the tissue that's being reacted. All autoimmune reactions start off in the same way. It's the mechanism, it's the tissue that they're affecting that differentiates one disease from the other. If you're autoimmune against one tissue, then you're probably going to be autoimmune against multiple types of tissues or problems. We can actually run a test from a company called Cyrex. It's a 96 tissue test, and this is an autoimmune reaction test. So we can actually see if you have the antibodies for an autoimmune type of condition. Now, there is no cure for autoimmunity, but we can do things in order to maximize our body's ability to be able to heal. We want to do everything that we can to help when we have an autoimmune condition. Now, autoimmune conditions are increasing every year in the United States. Most cases aren't even diagnosed. Most of these cases are going to continue to progress. Now, it's unfortunate, but conventional healthcare really has little to offer people that have an autoimmune condition, besides things like corticosteroids. Conventional and alternative healthcare may not fully understand autoimmunity and how it works, because what ends up happening is we really have a lot of tissue and cell destruction. Now, when we have an immune system that's being attacked, that's what happens in autoimmunity. So our immune system is mistakenly attacking healthy tissue as opposed to the sick tissue in our body. So it's making its own antibodies. It doesn't really distinguish between itself and what we call the non-self. So it really does not know which tissue it's attacking. And it just has a tendency to go out and start attacking not just the foreign problems, but your actual own body's natural tissues. Now, when we look at the immune system, we can divide it out into two parts. We have what's called natural barriers. So when we're looking at natural barriers, we're looking at things like skin, we're looking at the lungs, the eyes, we're looking at the respiratory system or mucus. We're also going to be looking at things like gut flora. Gut flora is an extremely important thing to be addressing. Now, like I said, our immune system has two parts. This has been described by Dr. Tcells in this book right here that's called "Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal?" If you really want to learn more about your immune system and the two different parts to it, I highly recommend that you pick up this book. Great book. It's going to give you a lot of information. So according to Dr. Tcells, when we're looking at our immune system, we're looking at two parts, Th1 and Th2. The Th1 response is also what's known as the innate immune response. These cells are the front line. They're the initial defense against any kind of foreign antigen that's going to be coming into our body. The Th2 part is also known as the humoral response. Now, this comes in response to adaptive immune response. So these cells, they tag the invader with antibodies for a more efficient immune response if they're ever exposed again. So we see that happening when you start to take things like vaccines. Now, in your immune system, what we see are Th3 regulatory T cells. this balances the communication between Th1 and Th2. Now, Th17 cells, in most autoimmune patients, Th3 is falling and Th1 and Th2 becomes out of balance. So what we're trying to look for all the time is basically a mediated response where we're going to have kind of this teeter-totter or seesaw type of effect, and we want to make sure that everything is in balance. When one of them goes out of balance, we start to see a problem. In an autoimmune disease, when the body attacks itself, there are two responses that happen. We have the Th1 response and the Th2 response. When a person is autoimmune, one of these systems becomes hyperfiring or dominant, and balancing this system, like we just talked about, becomes a problem. So Th1 is going to get more out of balance, or Th2 is going to get more out of balance. Now, cytokines. These are the chemical messengers between the immune cells. And the more out of balance, the more that seesaw or teeter-totter is going to go out of balance, the more tissue destruction is going to happen. You know what you're saying? Why is that happening? What's going to trigger your immune system to have this? Why is this happening to me? Well, there's a couple of reasons here, and we can look at those right away. What we're going to see, first of all, is dysregulation. When we're looking at dysregulation, the immune system is imbalanced because of stress that's put on it. When we look at stress, there's different forms of stress. We have things like environmental stress, we have physical stress, we have emotional stress, we also have things like chemical stress. So when we're looking at something like chronic inflammation from a diet, there are certain foods, especially when you have an autoimmune condition, that are going to be really, really problematic for you. We hear a lot of people talking about gluten-free diets nowadays, and there's a lot of people saying this is just bunk, you really don't need to be gluten-free. If you're autoimmune, that's when you need to be gluten-free. Not everybody in the world needs to be on a gluten-free diet, and there are some fads that are going along right now. You are going to lose some weight on it, but if you're autoimmune, if you have an autoimmune disease, you need to be on a gluten-free diet. Why? Because gluten, dairy, and soy are going to cause a lot of inflammation in your body. And the main thing that's happening with people that have autoimmune conditions is that they have a huge inflammatory response. There's a lot of inflammation there. We have to decrease inflammation. How do we do that? If we can eliminate gluten, dairy, and soy from the diet, we're going to be eliminating one of the major problematic areas. The other things we have to look at is blood sugar level. If your blood sugar level is out of control, also going to cause inflammation. The adrenal glands. Your adrenal glands are your stress glands. They sit right up behind your kidneys on either side. And if you have too much stress, whether it's physical stress, emotional stress, or environmental stress, you are going to be releasing cortisol. Cortisol at times can be good, but cortisol is toxic to your brain. So if you don't have the right amount of cortisol being released, if your adrenal glands are not functioning properly, or if they're overproducing things, then that's going to be problematic as well. We want to look at things like hormone imbalances, neurological imbalances, pregnancy, because when we have things like pregnancy, we're going to be looking at a conglomerate. We're going to be looking at multiple different types of imbalances going on as far as the hormones go. Extremely important. Low vitamin D as well. Now, the second thing that we can look at with your immune system is an active antigen. And what this is an immune system is imbalanced due to an invader, a foreign invader that's coming in, or what we call an antigen. So this can be something like a chronic infection, whether it's a bacterial infection, a viral infection, or even something like mold. And these can go in and they can sit in your stomach, in your gut. They can sit there for years at a time and go totally unnoticed, but they will be causing problems if they do exist in your body. Like I just mentioned, an infection in your gut, food sensitivities, environmental toxins, or leaky gut syndrome. When we have leaky gut syndrome, the food isn't broken down in your gut and it starts to leak out through the tight junctions, and that causes problems throughout the entire system. Leaky gut is a precursor to autoimmune disease. Now, when the body is attacking itself, polarity causes an activation and a release of what's called interleukin-17 cytokine, which causes a dramatic tissue destruction. This is going to cause that Th1, Th2 balance to shift, but that's not all. Interleukin-17 activates what is known as the cytokine-inducible nitric oxide system, or what we call INOS. Now, some of you might have heard the term nitric oxide, not to be confused with nitrous oxide. We want to make sure that we get that squared away. Now, when we look at something like an autoimmune trigger, we almost always see a problem with leaky gut. So what we have here is Th2 off balance and Th1. This leads to tissue destruction. As we start to have more imbalances, it's going to come around and we're going to have this vicious cycle that keeps going around. Poor Th3 regulation leads to more imbalanced Th1 and Th2, where we're going to get that seesaw effect again, and that's going to come back around and cause more tissue destruction. As this Th3 regulation continues, we get an activation of that interleukin-17, and that causes more tissue destruction. Then when we get the activation of the INOS, we get severe tissue destruction. So as we start to have this autoimmune trigger with leaky gut syndrome, it becomes a vicious cycle. Each one of these steps is going to be decreasingly diminished as we address it with things like functional medicine and nutrition. What we have to keep in mind is that 70 to 80% of our immune system is in your gut. If that gut is not functioning properly, if you're not able to break down the foods and get the nutrients out of the foods that you're eating, the vitamins that are in there, then you're going to have a problem. You've got to make sure that that gut is functioning properly, that you have enough acid in there in order to break down the food and get the proper supplementation from that. Now, when we have gut inflammation, usually it comes from a reaction to food, so a food sensitivity. So people that have food sensitivities, and we will run tests like that to make sure that that's not a problem. But if you have food sensitivity, that's going to lead to a production of inflammatory cytokines. That's then going to lead to leaky gut, more food sensitivities, and we get that circle again. Now, inflammatory cytokines cross into the bloodstream, and they cross what's called the blood-brain barrier. So this is where the brain is actually going to come into play in the neurological aspect of it. Because these react with the brain immune cells, which we call microglials, and then that causes inflammation in the brain. When you have an inflammatory response in your body, it's not just the body that's being inflamed. There's inflammation on the brain as well. If you have fire in the gut, you got fire in the brain. Now, is there another option to steroids? All I keep hearing from my doctor is I need to take steroids and I have to stay on them for the rest of my life if I have an autoimmune condition. Well, first and foremost, what we have to do is we want to remove the autoimmune triggers. We like to determine if you are Th1 and Th2 dominant. This is going to go through some proper testing, because what we want to do is we want to adjust or avoid the wrong stimulants to the weak side. We want to make sure that we're supporting the right part of the system, of the immune system. We also want to support Th3 regulatory systems and suppress that interleukin-17 that we just talked about, as well as the INOS activity. So what do? We remove the triggers. We're going to do things in order to help leaky gut syndrome. One of the products that we can use is called repairvite. We can actually use a multitude of different products from different companies. This just happens to be one example. We want to make sure that we get rid of gut infections. We want to stabilize blood sugar levels. We want to make sure that we address food sensitivities and also chronic inflammation. So how do we do this? Well, one of the ways that we can decrease chronic inflammation is we can use something called co-curcumin. Co-curcumin is actually a combination of coenzyme Q10 and curcumin. You might have heard some things about curcumin. Curcumin is a natural substance, and what it does is this is going to decrease inflammation. But this is not like taking an Advil where it's just decreasing inflammation on a site. This is decreasing the inflammatory response throughout your body. Extremely important. Now the repairvite program is an aggressive and it's a complete program. This is designed to break the actual vicious cycle of the leaky gut, and this is one approach that we can use. What is the functional medicine approach? Well, functional medicine, what does that mean? You might have heard this term recently. When we're looking at functional medicine and we compare that to traditional medicine is looking at symptomatology. So if you come in with heartburn, we're going to say, well, you've got heartburn, let's give you something in order to get rid of that symptom. You might go to a naturopath, you might go to your chiropractor, and they might give you something natural in order to deal with that symptom as well. Now the functional approach is saying, well, you're having heartburn, maybe there's a problem somewhere else. Maybe there's not enough acid in the gut. Maybe that's causing hypochlorhydria, where that lack of stomach acid is starting to cause lactic acid to come back up and give you that burning sensation. Maybe there's a problem in your liver as well. Maybe we have a problem in the gallbladder. So we're going to look at that. We want to look at that functional approach so that we're not just treating the symptom, that we're actually trying to get rid of the problem. So with the functional medicine approach, we want to determine if you're Th1 dominant or Th2 dominant, and then we want to give you the appropriate supplementation. We want to make sure that we're going to stimulate the Th1 response and stimulate the Th2 response. We don't want to give the wrong things for the wrong pathway. That's why sometimes you hear people say, well, you know what, I heard that you can take green tea for cancer, but it really doesn't work. Well, it's not going to work if you're Th2 dominant. If you're Th1 dominant, that's what you want to be taking. But you've got to make sure you're taking the right thing for the right pathway for the right person. We want to support the Th3 immune system with vitamin D, glutathione. Glutathione is a fantastic product. Glutathione is naturally made in our body. This is the #1 antioxidant that's made in our body, and sometimes what we have to do is we have to introduce it back into our body or stimulate it, the production of glutathione in our body. Either way, we can go about it in two different ways, and that's going to help to decrease a lot of the inflammatory response as well. Fish oils are extremely important, as well as nitric balance. Okay, so this has that nitric oxide in it. Now, what is the role of glutathione and nitric oxide in autoimmunity? Glutathione found in products, so one example is a product called Oxycell. So it's a tripeptide compound and it acts as an immune modulator. It's an antioxidant. Like I said, the #1 antioxidant in your body. It's also a hepatic detoxification substrate. So what that means is this is going to help to detoxify your liver. Glutathione is the main protecting antioxidant for cellular mitochondria. The mitochondria is the powerhouse. It's the working part of the cell. So this is where all the energy is made in our cell. So this is extremely important. Now this exists in a reduced form called GSH and an oxidized form called GSSH. It's oxidized by glutathione peroxidase. Now some of the immune triggers. When we have an immune trigger, we get an immune response. This leads to oxidative stress. That leads to a depletion, so we lose some of the glutathione stores, and it activates that INOS system. When we activate that INOS system, we're going to have more tissue destruction. We're also going to have T lymphocyte activation, and that's going to lead to autoimmunity. Do we see now how all this starts to come into play? So we get this cycle. During the oxidative stress or immune response, GSH is being converted to GSSH by glutathione peroxidase to protect and to quench oxidation and inflammation. We want to make sure that we're decreasing that amount of inflammation that's going on in the body. Now, when we look at something here like glutathione, we see that circle. The glutathione recycler is a product used to support the synthesis and recycling of glutathione, as well as to support the activation of glutathione reductase. So another product that we can use besides Oxycell is glutathione recycler. So glutathione is an environmental compound that activates the immune system only after glutathione levels are depleted. High levels of glutathione are critical to dealing with autoimmune responses and autoimmune diseases. So glutathione recycling is going to enhance tissue and intestinal regeneration. It's going to enhance autoimmune tissue destruction recovery. It's going to stop that T17. It's going to activate Th3 regulatory cells. It's going to modulate Th1 polarization. It's going to protect the cell. It's going to prevent the activation of this INOS system that we talked about and dampen the autoimmune response. So all of this is going to go together with this glutathione in order to help with that recycling and mediate that cell response in autoimmune conditions. So what's the role of nitric oxide in autoimmune modulation? Well, nitric oxide is an important messenger molecule involved in many physiological and pathological processes. It plays both a destructive and a protective role in autoimmunity, depending on which isomer is actually expressed. Now, when we see nitric oxide synthase isomers, so we have NOS, which optimizes neuronal synapses and is very protective of the brain. eNOS, which helps tissues recover and regenerate. It enhances blood flow and dissolves epithelium plaques. It also dilates or opens up the blood vessels. So this is extremely important when we're dealing with people that have peripheral neuropathy. When you have a tissue destruction of the actual nerves and the blood vessels, it's very important to get a lot of blood there. And by taking a product like Nitric Balance, through the eNOS system, we can actually get those blood vessels to dilate and allow more blood to flow to the periphery. So this is going to be extremely beneficial for people that do suffer from peripheral neuropathy. Now we're dealing with iNOS, that's going to promote tissue destruction, it's going to promote inflammation and promote autoimmune attack. So we want to make sure we're doing everything we can in order to avoid this iNOS reaction. Now, what kind of nitric balance? You don't use products that use arginine to raise nitric oxide with autoimmunity, because it increases that iNOS response. We want to make sure we decrease that iNOS response. Nitric balance, like I talked about, provides compounds that are used to support the expression of eNOS and nNOS, the good ones, while dampening the iNOS. So, how do we put all of this together? Well, when we're looking at something like the intestinal membrane, the mucosa, we see antigen immune activation. So GSH and nitric oxide enhance and repair the intestinal mucosa. So these things are going to go together to help with that, the gut, because like we talked about, 70 to 80% of your immune system is in your gut. So GSH and nitric oxide are going to initially stop that inflammatory response. They're going to help to support the regulatory T cells, and they're also going to modulate that Th1 and Th2 balance. So GSH and nitric oxide support are going to help tissue recovery. That's the bottom line. When we have a leaky gut, we have a vicious cycle. We're going to start off with a loss of tight intestinal junctions. Normally what we have in our body is we have what's called tight junctions. That means that everything is locked together. And as we start to get this loss of tight junction, food is going to separate out. Food can actually leak through. And as that food comes through, we get an entry of antigens and peptides. You get multiple food sensitivities, and this leads to intestinal inflammation and a loss of tight junctions. And this circle or cycle just keeps going around and around and around, and then we never really know why we're not getting better. So there are certain things that we can do for leaky gut. One of them, like we talked about before, is repairvite, but we're also going to have dietary restrictions. You have to eat only the allowed foods, because what you're trying to do is get that gut to heal properly. Now, autoimmunity is a metabolic problem that involves multiple areas of bodily systems. What is metabolism? When we hear about neurometabolic care, what is metabolism? Well, metabolism basically is you eat your food, that gets converted to energy. That is how metabolism works. So, 30% of our energy goes to what system? Is it the endocrine system, the digestive system, the nervous system, the immune system, or your cardiovascular system? Which one? I'll give you a second to think about it. The answer is our nervous system, our brain, our spinal cord, and our nerves. This is one of the most important things to remember. If you have a metabolic problem, your brain will not be working properly because your brain is the most metabolically active organ in your body. Let me repeat that. Your brain is the most actively metabolic part of or active organ in your body. So brain fatigue and misfiring. What happens when you do have brain fatigue? How does all of this tie together? When we look at the body and brain connection, your brain is a sensory organ. So it's taking in what's called somatosensory information. Your body is basically one big receptor. It's like a sponge. We have receptors everywhere. We have receptors in our muscles. We have receptors in our joints. We have receptors in our skin, in our eyes, in our ears, in our nose, in our mouth. All of these different types of receptors are going to bring information back to our brain, and our brain is able to process it. The biggest receptor that we have is touch and gravity. The reason why we can't send astronauts into space for long periods of time is because they start to lose things in their body. They literally will start to lose their mind because our bodies are designed to react to gravity. That's the way that we work. So the number one input on our bodies is gravity itself. There are three parts of our brain. When we're looking here, we see the cerebellum. The cerebellum is also known as the little brain. The next thing that we're going to see here is the brain. And then what we're going to see is the brain stem. So we have our brain, which we actually have two brains, our right brain, our left brain, our brain stem, and our cerebellum, or our little brain, which also has two sides to it, our left and our right. Now, how does the brain work? Well, sensory input from the body goes to the same side cerebellum first. So anything that's going to come up to the same side cerebellum, that is then going to cross over and get sent to the opposite side brain and then pushed out into different areas of the brain, whether it's the parietal lobe, which we call the somatosensory area, specifically to an area called areas 3, 1, and 2, or the temporal lobe or the occipital lobe. Or the frontal lobe. Now, the upper brain has connections to our brain stem as well, and the brain stem is going to be inhibitory. It's going to keep the brakes on. It keeps everything under control. This is where we find things like our fight or flight response for our nervous system. So without this braking, all of our sympathetic nerves, our fight or flight response, would cause chronic conditions to occur on a daily basis. So we're seeing that communication here between the cerebellum, the brainstem, and the opposite side of the brain. Now, when we have an overfiring of the sympathetic nervous system, our sympathetic nervous system is our fight and flight response. So this is when you happen to be driving down the street and you're speeding, and all of a sudden you hear a siren. This is triggering your fight or flight response. Try running down the street as fast as you can and eating a hot dog at the same time. Not going to happen. That's your rest and digest, or your parasympathetic nervous system. Right now what we're talking about is the sympathetic nervous system, fight or flight. When we're dealing with the sympathetic nervous system, we're seeing things like chronic pain and fatigue, irritable bowel syndrome, urinary tract infections, fibromyalgia, migraine, tension headaches, poor posture, or adrenal gland stimulation. Now, an overfiring sympathetic nervous system can also cause things like blurred vision, increased sweating, dizziness and vertigo. It can cause you to have cold hands and cold feet, and a sensitivity to light and sound. The reason why this happens is because in your midbrain there's an area called the superior and the inferior colliculus. In your superior colliculus is the nuclei for your eyes. In the inferior colliculus, that's where your ears go to. So if there's something happening in that midbrain, then that's why you're going to have an oversensitivity to light coming into your eyes and also sound coming in through the ears. So what happens when we have cerebellum fatigue, when that little brain gets fatigued? What ends up happening? Well, you can end up having problems like a loss of balance. You might have some vertigo. You might have some chronic back and neck pain. Why does this happen? The cerebellum has certain functions. It's going to control your balance, your coordination. It's going to control all of your postural back muscles. It's also going to terminate your eye movements. If I go and move my eyes to the left, they don't keep going. They stop. And that's the cerebellum that's going to do that. So when you start to see things like headaches, clumsiness, dropping things, disorganized thinking, that's when we start to think that there's a problem with that cerebellum and we're experiencing cerebellar fatigue. The frontal parietal lobe and temporal lobe fatigue. This results in a lack of inhibition of the sympathetic nervous system or the fight or flight response. So what we're getting then is more of a sympathetic response, more fight or flight. We're not able to rest and digest. So upper brain fatigue can cause depression, it can cause anxiety, it can cause difficulty in scanning. You might not be able to read properly, difficulty in adding or subtracting, verbal expression. You might have some difficulty understanding language. You might have some decreased memory or learning difficulties, maybe even a lack of focus. Upper brain fatigue can also cause altered sensations, so numbness and tingling, changes in your handwriting, anger or increased irritability. There might be some body weakness or a lack of motivation. We also see this a lot with people that have learning disabilities, in dyslexia, ADD and ADHD. How does this happen? It happens from stress, different kinds of stress. Emotional stress, loss of a loved one, loss of money, a divorce, a loss of a family member. Chemical stress, too many drugs, physical stress, an accident, a sporting injury. These all cause the brain to fatigue, and these are going to decrease the amount of impulses fired in the nervous system. So chemical and physical stress to the brain are going to cause certain things to happen. You may have anemia, blood sugar imbalance, food sensitivities, immune system imbalance, poor diet. You might want to take out a pen and write some of these down here. Hypothyroid function, prescription, non-prescription drugs, chronic inflammation, and hidden infections in the gut. These are all metabolic problems that create nervous system imbalances in the brain. Now, emotional stress to the brain, adrenal gland disorders. So if you have cortisol imbalances, anti-insulin effect on tissues, it raises your blood sugar level too high, and then you end up having high triglycerides, LDL, and cholesterol. High insulin and glucose levels cause a breakdown of your brain and nerves. If there's too much sugar in your body, in your nerves, that's going to be a problem. This is why we see tissue destruction with diabetics and why they see peripheral neuropathy. There's too much sugar, it destroys the nerves. Now, the cerebellum and the brain require two things to function properly. They require fuel and activation. So fuel comes in the form of glucose and oxygen, and activation comes in movement. So things like movement, exercise, just keeping moving is going to be extremely important. Have you ever been told that your lab tests are normal? Just like the cover of the book. Well, if you've been told that they're normal, maybe it's because the lab ranges that they're using are inaccurate. When they do a lab range, they use a bell curve. So they're using the actual numbers of all the patients that came into that lab throughout the course of that year. Who's going into the lab? Well, for the majority, it's the sick people. But when they have that functional lab range, if they're not using it functionally, they've got a much wider range. We want to keep a functional lab range. These are much more sensitive to reveal underlying problems. So this is why when your lab tests are normal, you feel sick. Abnormal low levels, functional lab ranges, abnormal high levels. We see how much broader that range is. We want to have a tighter range here. So when we look at things like functional ranges, you can take out a piece of paper and write these down if you want. When we see something like glucose, the functional range is between 85 and 100 milligrams per deciliter. The traditional high and low range is between 65 and 110. Now, hypoglycemia we're going to see at 73. Now, what if your blood sugar level was at 110 and they're telling you, well, you're fine. We're just going to wait until you become diabetic because there's nothing we can really do. Well, we're not trying to do that. We want to look at this and we want to make sure you don't become diabetic. We don't want you to stay on medication. We want to make sure that your ranges are functionally okay so that you are healthy. If your TSH, this is thyroid stimulating hormone, is between 1.8 and 3.0, that's where you should be. But if you're up here at 5.7 and they're telling you, well, you're okay still, no, you're going to end up having a thyroid problem. We want to make sure that we keep a tight control here, okay? So we have functional ranges that we limit our testing to, and that's the way that we come up with our proper diagnosis. Now, based on your history, we may require to run different types of tests. We may want to look at something like a CBC, if that's not been run yet, a saliva hormone test. We can also look at a stool profile. We can look at food sensitivities and also your adrenals. And like we said, food sensitivities, looking for leaky gut syndrome. Autoimmune testing to include measuring to see if your immune system is mistakenly attacking over 90 different tissues in your body. So what makes our office different from every other doctor that you've seen? Well, we treat our patients neurologically and metabolically. Now, I'm here to tell you that no stone is left unturned when you come to our office. We want to find out, we want to be able to determine what is the exact cause of your condition. Why are you suffering this? So how do we do this? Well, in our office, in the first 2 visits, what we do on the first visit is a complete neurological examination. I'll go through and I'll review any existing labs that you bring in. I'm going to have you fill out some paperwork before you come in here. One is going to be called a metabolic assessment form, and the second one is going to be a neurotransmitter assessment form. I would really, really like you to be here with your spouse or your significant other so that you can see what's going on with them, so that you're not getting secondhand information. It's very important to be able to know and to have somebody there that can actually support you physically and emotionally. Now, on visit 2, what I'm going to do is I'm going to go over your case review. I'm going to give you my best recommendation, and if I accept your case, I don't accept everyone as a patient. If I accept your case, then what we're going to do is we're going to overview further complete testing to be done. I'm going to review all of your neurological findings and all the testing that I've found, and I will give you my treatment plan. When we do that, we're also going to review any kind of financial obligation that's there. And for this, it's extremely important that your spouse is there, because I don't want you going to make any kind of decision without your significant other there. I really don't want to see anybody without their spouse or significant other present on that report of findings on the second visit. So what else do you need for your first appointment? Well, first and foremost, I only accept about 5 new autoimmune patients a month. This really takes a lot of time to come up with these plans and to be able to give you the proper type of care that's needed. These first visits generally cost about $450. But if you go ahead from watching this video, then what I'm going to do is we're going to do that for $75. So it's $75 for that complete examination. And the next 2 visits are going to be at no charge to you. That a second visit and one additional visit, there will not be any charge, because I really want you to see what we can do and how we can help you in our office. We are in network with some insurances. We can verify that for you, but a lot of times they're really limited onto what they cover as far as a neurometabolic care. So on a scale of 1 to 10, how serious are you about your illness? How has this affected you with regards to your relationships? What about work? What about your ability to enjoy life on a daily basis? On a scale of 1 to 10, how serious are you about eliminating your illness? Now, due to time constraints, I can only accept those patients who are truly, truly committed. So when you're ready to make a commitment, when you know that this is something that you want to do, you want to make a change in your life, you've got an autoimmune condition, and you really don't know what else to do, please, please give me a call. It's area code 802-230-4678, and we will set up an appointment for you, and we will hopefully make sure that we can do something in order to help change your life. Thank you for watching this video, and if you have any other questions, please don't hesitate to call or send us an email. Thank you, and have a great day. Bye-bye.